first encountered Capacitar in 2007, it was amazing to me to focus on the idea of healing ourselves and healing our world because of the work that I was doing already for mental health system change here in California and in the USA. And so yesterday in our workshop we talked about so many things. We actually heard from everyone in terms of their personal experience that brought them to the interest in mental health advocacy and how they're using Capacitar related to mental health, which was a very rich discussion. But for myself, I have done a lot of work with wanting to recognize that people who have experiences with mental health challenges, that is such a common thing in life these days. Actually, the current statistics show that 1 out of 4 people will experience a mental health challenge in their lifetime. So it's not about some other group of people that is so very different. It's about ordinary people who encounter stresses and challenges in life that compound in a certain way that causes just too much challenge, too much difficulty, too much stress. So it's really a bio-psycho social, spiritual issue. It's not just a biological issue as we so often are told. And so a lot of what I like to share with people about is how important it is to be non-judgmental, to be willing to listen and recognize the strengths that everyone has. And Capacitar is such a lovely tool to share in environments where people are healing, because it helps us be in touch with ourselves. It helps us heal from the inside out. And that's so meaningful. When someone has been diagnosed with a mental health challenge, they're usually not only healing from the life experience that was challenging, but from the experience of being diagnosed and separated, isolated, pathologized, and then also often trying to heal while taking very disabling medications. And so there's so much to heal from when you're in that situation. So I did also talk about a particular technique that I'm finding really helpful as a pairing with Capacitar here in the US, and that's the Wellness Recovery Action Plan, which is a self-help plan. We approach people with the idea that you are the expert on yourself. You know yourself the very best. And so what do you think works well in your life to help you stay well or feel better? And then we build on that with a plan. And so Capacitar is beautiful with that because the protocols are like wellness tools. Mm-hmm. And so, I'm sorry, Lucy, I'm going on, but that was one of the things I wanted to really share with people is how wonderful it is to use a plan like the Wellness Recovery Action Plan that's really based on peers helping each other to focus on wellness and get well.
Mm. And what we did in the workshop as well was EFT. Mm-hmm. And you changed my understanding of EFT, because in South Africa we tend to say, despite the fact that I have this problem, and Sharon uses the word situation, despite the fact that I have this situation, I'm okay, I respect and love myself. And that's quite a shift, that it's not problem orientated, that we choose or we find ourselves in situations. And so when Pat came to South Africa about 7 or 8 years ago, she was like a breath of fresh air, because she linked the body, the spirit, the mind, the emotions. And we are actually quite a conservative, traumatized country. And so she brought a wealth of wisdom and literature and articles. I remember particularly the one about the doctor as mechanic and the doctor as gardener. Yeah. So for me it brought in, I've always been interested in complementary healing methods, and she brought it together and she made sense of it. And there was evidence-based stuff too that we could use with those people that were more inclined to the Western way of thinking. She really encouraged us to look at our own indigenous healing practices, of which there are many. And she said, make Capacitar your own. So we have a number of manuals that I've just given to her, and they come from the field of AIDS and wellness, women's wellness, and also my particular interest is end-of-life care. So we're using it with children and with adults, and particularly with the carers. So that is self-care and care for the caregivers. And because we don't have many safety nets in South Africa in terms of nurses, we have carers. And often women who are HIV/AIDS positive themselves are out there caring for others. So this work has brought them a huge amount of recognition and wisdom that they use for themselves and they pass on to their patients. And personally, it has transformed my life, and it will continue to do so. And my dream is that in 2014, I think, that we're all going to meet somewhere in Africa, because after all, that is the cradle of humankind.